Good evening, everyone. I'm delighted to welcome and thank you all for joining tonight's webinar, The Benefits of Canberra Script, which is hosted by Capital Health Network and ACT Health. I'm Jeanette Wade, the ACT and Southern New South Wales Health Pathways Program Manager. Before we start, I wish to acknowledge the traditional custodians of the land we are meeting on, the Ngunnawal people. I wish to acknowledge and respect the continuing culture and the contribution that you make to the life of this city and this region. I would also like to acknowledge and welcome other Aboriginal and Torres Strait Islander people who may be attending tonight's event. All participants have been muted. Please address any questions to the Q&A box in your Zoom window, and it will be answered in the question and answer session, which will follow the presentations. This presentation will be recorded, and the link and other resources will be sent to you following the event. I would like to thank our guest speakers for their contribution in the delivery of this educational event and introduce you to tonight's facilitator, Amanda Galbraith, the Acting Chief Pharmacist at ACT Health.
Thank you, Jeanette. Good evening and welcome to our very first Canberra Script webinar. My name's Amanda Galbraith and I'll be your facilitator this evening. I'd also like to begin by acknowledging the Ngunnawal people. I'll provide an acknowledgement in Ngunnawal language. Daiwura Nuna, Daiwura Ngunnawal, Yangu Nalaweri, Duni Munyan, Ngunnawalwari, Daiwurawari, Ningara Dindi, Wangarali Jinyan. This is Ngunnawal country, and together we're meeting together on Ngunnawal country. We always respect elders, female and male. For those whom I have not met previously, I'm the Acting Chief Pharmacist and Senior Director of the Pharmaceutical Services section for PSS. I have come to this role after more than 25 years as a community pharmacist in the ACT and New South Wales, where I've contributed to patient care as a community pharmacist and owner of several community pharmacies. I'm also a diabetes educator and board director of a few pharmacy and health-related not-for-profit boards. My team and I are very pleased to be here with you this evening to talk about Canberra Script, and I'd like to thank the Capital Health Network for this opportunity. I'd also like to thank Dr. Marianne Bookallil for joining us to present a few case studies that I believe will demonstrate the value of Canberra Script to individual patients, prescribers, and the Canberra community more broadly. Following Marianne, our Deputy Chief Pharmacist, Michael Fitzsimons, will go through the key features of Canberra Script, share some tips with you, and show you how to access help in a live demonstration of the system. So what is Canberra Script? It's the ACT version of the National Real-Time Prescription Monitoring System. It replaces our Aging Drugs and Poisons Information Service, also known as DAPIS, and DORA, the DAPIS Online Reporting Access System. They were deployed in 2014 and 2019, respectively. Canberra Script provides information on any ACT patient who has been prescribed or dispensed monitored medicines. It's intended to support clinical decision-making and ensure medicines are used safely and effectively. It enables health practitioners to better identify and manage patients who may be at risk of harm or dependency. And ACT Health's vision for Canberra Script is that prescribers and pharmacists use Canberra Script to provide more safe and effective care for ACT consumers. So why do we need Canberra Script, or more generally, real-time prescription monitoring? Sadly, we now know that since 2008, drug-induced deaths have surpassed the road toll each year. There's also strong evidence that shows the emergence of a very concerning trend. Over the last decade, drug-induced deaths were more likely to occur due to prescription medicines than illicit substances. We've also seen a threefold increase in cases involving opioids, and benzodiazepines are now becoming the most commonly involved drug class. So it's not really surprising to learn that there have been many coronial inquests throughout Australia where coroners have recommended the implementation of real-time prescription monitoring to help save lives and reduce harms. Nor is it surprising to see the issue of overdose deaths caused by prescription medicines continues to attract media attention. However, I'm pleased to say the calls have been heard, and we are now in a position where almost the entire country has real-time prescription monitoring in place. WA and Tasmania are expected to come online later this year, and they're the last two. The benefit of this arrangement is that the system interface across all jurisdictions looks practically the same, albeit with a different name in each jurisdiction. This helps prescribers who may move to different jurisdictions to be able to easily use other versions. More importantly, subsequent to the Minister for Health's declaration in August 2021, Canberra Script now monitors a broader range of high-risk medicines. This came into effect in October last year. These now include all benzodiazepines, codeine and tramadol, pregabalin, gabapentin and quetiapine, and the Z drugs, zolpidem and zopiclone. These also include all forms and strengths of these medicines, even if prepared in combination with a non-monitored medicine, for example, Panadine or Panadine Forte. Our aim and hope is that health practitioners can use this broader view of patient medication data to help identify patients who may be at risk of harm or dependency. But I also want to be very clear that Canberra Script is not intended to disadvantage patients who have a clinical need for a medicine. Rather, what we are working toward is an informed community of prescribers and pharmacists who willingly and confidently engage with Canberra Script to identify concerning patterns. We want you to feel supported, to have impactful conversations with your patients, and to feel like you can do something to assist the person in front of you. Just like if you were to take a blood pressure of your patient before prescribing their blood pressure medications, we aim that all prescribers will consult Canberra Script before prescribing any of these monitored medicines. I'd now like to introduce Dr. Marianne Bookallil. Dr. Bookallil is the Clinical Director at the Interchange Health Cooperative. She has an interest in drug and alcohol services and is an endorsed prescriber. Dr. Bookallil also works closely with Pharmaceutical Services in her role as Chair of the Medicines Advisory Committee. Dr. Bookallil is here to give us the benefit of her experience as a GP, public health physician, and regular user of Canberra Script. Please join me in welcoming Dr. Bookallil.
Hello. Thanks, Amanda. So I'm presenting two cases today. Because they show how doctor shoppers can be identified with Canberra Script. I'm not using real cases, but every part of these cases have, because I don't have consent from the patients, I'm unable to use real cases, and I don't want to identify the doctors either. So these cases are amalgamations of patients I have seen, so they're not purely figments of my imagination. Thank you to the Pharmaceutical Services team for adding the dummy cases into Canberra Script. The management of these patients is based on addiction management principles such as harm minimisation and containment. Can we go to the next slide, thanks? So JB is a 69-year-old ex-military man who's living quietly in Canberra with his new partner. During his time in the military, he developed PTSD, osteoarthritis, and a back injury. The back injury seems to have occurred years ago. He was treated with opioids for the back pain and diazepam for muscle spasms. He found that he liked the medications a little too much and tended to over-medicate himself, because if he was sedated, his PTSD symptoms seemed more manageable to him. Needless to say, he developed opiate use disorder and was successfully treated with Suboxone. His diazepam use was contained by using stage supply. However, JB was able to work out what the rules were and skirt the rules, avoiding red flags. So we go and look at Canberra Script, please. Okay. So this is the file we created for JB. As you can see, it's quite busy. So when I first look at the slide, or when I first look at a person's file, what I do is I look at the alerts, which are on the far left. You can see the amber alerts, and a bit further down, you can see red alerts. So the amber alerts tend to identify issues where scripts are prescribed within one practice. I tend not to worry too much about those because I can look at our own system, our own medical record, and can check the scripts in much more detail. The red alerts occur where there's multiple practices involved. Where there's a single red alert, it usually turns out to be something relatively benign, such as a dentist prescribing some low-dose opioids after a procedure. Sure, they probably should have applied for a CHO approval, but that tends to be pharmaceutical services problem and not mine. So the medication has now already been used, no harm down. But when there's a sea of red, that's when I'm more concerned. So the other thing I look at is the doctor's names. So you can see practitioner details. It's the third column from the right. And you can see the doctor's names, and I think Shawan has just filtered by doctor's names. So there's a few doctors there. There's actually 3. So Noah Kananga is the main doctor. Noah's prescribing both Suboxone and diazepam. So the second doctor there is also belongs to the same practice and is Dr. Murak. So we'll just go down and show Dr. Murak. You can see that Dr. Murak has an orange alert, and that's just saying that another prescriber at the practice is supplying diazepam. Now, if you actually look a little bit closer at the dates, it looks like the timing's appropriate. So presumably the main doctor was just unavailable that day, and so an appointment was made with another doctor at the same practice. So that's not a particular concern. However, the third doctor, Dr. Gorner, works at a different practice. And you can see red alerts next to Dr. Gorner's name. Again, prescribing diazepam. So what's happened here is that JB has 2 regular practices and 2 regular pharmacists. So from each practitioner's perspective, he's not coming in too often. He's not eliciting any red flags. He's not getting his scripts early. He's not pharmacy shopping. Essentially, if you just look from a one practice perspective, he's fine. He's worked out, but what he's done is he's worked out what our red alerts are. So now let's see, it's the 16th, I think is the date I worked out that he gets sprung. We look, I think it's the 16th of May. Yeah. All right. So Dr. Noah Kananga checks Canberra Script on the 16th of May. What he sees is that not only is he prescribing diazepam and the Suboxone, but there's another regular prescriber of diazepam. So instead of JB getting 2 tablets of diazepam that Dr. Kananga knows about, he's actually getting 4.5 a day. So obviously not ideal. So in this situation, what I tend to do is I tend to show the patient their Canberra Script entry or their own Canberra Script entry and just point out that, you know, look at this, I can see what's going on, and, you know, I can see that your doctor's shopping. Try and get an explanation and see what's going on. So in this situation, JB realizes that their gig's up. The doctor and patient negotiate. So JB signs a voluntary undertaking and agrees to only attend 1 practice. Dr. Kananga agrees to prescribe a little more diazepam in the short term. So was taking a total of 4.5 tablets a day. Dr. Kananga prescribes 4 tablets a day for a week and then down to 3 tablets a day, with the long-term plan is to get him back to 2 tablets a day. And you can see that that takes a few scripts to do that. It doesn't get back down to 2 tablets a day until June, is that right? Yeah. So the other thing Dr. Kananga does is write to Dr. Gorner and just let him know what's going on. Dr. Gorner doesn't prescribe anymore, and JB remains fairly stable in the long term on Suboxone and diazepam. All right, so that was the relatively easy one where the patient chooses to prescribe, or the patient chooses to follow the recommended treatment. So can we go to the next case study, please? All right, so this case study is of a CE. She's a 41-year-old single woman. She's only recently moved to Canberra from Queensland sometime at the end of last year. She's still got an adult son in Queensland. Next slide, thanks. So she was first prescribed opiates, diazepam and pregabalin when she was injured at work in 2007. So in 2010, she had a psychological workers' compensation case that she lost, and she actually hasn't worked since. So her main doctor in this scenario is Dr. Dorian. Dr. Dorian organised a transfer of records. It turns out that the GP she was seeing in Queensland provided comprehensive care, was prescribing Tarjan 2010, but no diazepam or pregabalin. So Dr. Dorian just declined to prescribe these medications when requested. This didn't really stop her, and as you can see, CE managed to obtain the medication elsewhere. So if you look at the Canberra Script file, it looks really quite messy. You can see lots and lots of scripts and lots of dates and different medication. And it's a little bit hard to make heads or tails of what's going on there. Shalwyn, can you just sort by dispensed scripts only, thanks? Yeah. All right. So in Canberra Script, each actual script usually has 2 entries. One's for the prescribing, assuming it's prescribed electronically. If somebody gets a script from emergency where they don't prescribe electronically, it doesn't register. And then one for dispensed events. So here we're just prescribing, we're just looking at the prescriber information. So I think we can see 3 different prescribers. We can see John Dorian has the top medication, that's tramadol. The next one down, sorry, I lied. He has Tarjan. John Dorian has Tarjan. Tramadol is next down, and that's prescribed by OMIX. And then it gets a little bit messy with some diazepam and pregabalin. Right. So, Shalwyn, do you mind just grabbing all the opiates? Thanks. Unfortunately, this can't be done manually, so Shalwyn's just going to identify all the opioids and okay. So I think Shalwyn's now removed the diazepam and pregabalin, and we just have opioids left. So you can see probably in the first 3 weeks of January that there have been 3 scripts of opioids from 3 different prescribers. And later in January, Dr. Dorian's prescribed again. The dose of, well, my guess is that either she's not taking it as prescribed and taking quite a lot at once. I'm guessing that because there's only 5 days between the 2 tramadol scripts by 2 different prescribers. Or she's selling it, diverting it or selling it, making a little bit of extra cash on the side, because frankly, not a huge amount of money on the pension. If she were taking all this medication as prescribed, it works out as about 140 milligrams of morphine equivalent. So that's actually quite a high dose. Okay. So filtering is quite useful to try and work out exactly what's going on. So I'm just going to say that Dr. Dorian looked at on the 26th of January. Can we just, yeah, so that entry there. Dr. Dorian looked at the entry and discussed this with the patient. So he decided to give her a chance, even though she's obviously doctor shopping. He got Carla to reluctantly sign a voluntary undertaking and she promised not to go to other doctors. Dr. Dorian increased the stage supply to twice weekly. Not sure that this strategy will work. Her opiate usage is almost certainly higher than the 20 milligrams of Tarjan twice a day. So restricting that supply, is probably not a bad idea, but it's not going to hold her, I imagine. And it completely ignores the diazepam and the pregabalin that she's also getting. So in February, we'll just have a look and see what's happened since then. So she still gets tramadol from a couple of prescribers, but we then look at the 20th of February. Yeah. So after the appointment on the 26th of January, she's promised not to go elsewhere, and she still does. And Dr. Dorian says, that's enough, I'm putting you on methadone. So you can have a look there, and they're just starting methadone. That's probably not unreasonable. This time, Dr. Dorian's a bit more thorough and writes to the other prescribers and asks that they don't prescribe any more opiates, and he's going to do all the management with methadone. So if you scroll down a little bit further, so the two previous prescribers are no longer prescribing, but Carla's managed to get more opiates from other people. So some Panadine Port from a Dr. Strange, some more tramadol from a Dr. Lexi, and I think there's some endone that she ends up getting from the hospital. All right. So this is somebody who's, not particularly interested in stopping their doctor shopping. Shawan, can you just filter by pregabalin, thanks? So if you have a look at these pregabalin scripts, it's so much easier to see now that there's only pregabalin on the page. And it looks like there's about one script a month. In April, there's 2, but mostly it doesn't look like excessive use. So it is possible that she's just using the Lyrica, taking one twice a day as prescribed, maybe an extra one every now and again, but it doesn't look terrible. The real problem is that this is another sedative medication on top of the opioids, on top of the methadone. So it would be much better that it was being prescribed and dispensed by one doctor and one pharmacist. So, Sharon, could you show us the Valium? Thanks. So again, much easier to see when you've only got diazepam and you've only got the dispensed events as well. So you can see that there have been 5 scripts in 4 months. It's approximately once a month, maybe a little bit less. So she's probably, if she's taking it all, getting sort of 2 to 3 tablets a day on average. Certainly much more than the 1 a day that's prescribed by every single doctor, no matter where they're from. You can see that Dr. John Dorian has decided in March that it's, he would much prefer to have all the medications being managed by him, and has agreed to take over and prescribe the diazepam. So unfortunately that doesn't work because he's been quite strict with her. His 1 tablet a day is stage supply. She must pick it up with the methadone, which is also being picked up daily. So she's not able to take more than 1 if she wants to. She's not able to sell it if that's what she's doing. So that doesn't work for her, and she's gone elsewhere. I think at this point, Dr. Dorian gives up. He sends her to the Drug and Alcohol Service and refuses to prescribe anymore. Probably also has a quick chat to Pharmaceutical Services, just in case for some reason they haven't noticed what's going on with this patient. All right, so I guess that's my 2 cases. If there are any questions, I'm happy to answer them now or at the end.
Marianne, we've got one that you might be able to answer, or I might ask Michael to answer, which is, can we see New South Wales residents? And the answer from my knowledge is only if they've had their prescription dispensed in the ACT. But moving forward, of course, we hope to have some more collaboration across states and territories, but for the moment it would be if they had it dispensed here. And there's another question around, I think the question is asking, there must have been a large script for one of the medications. Was it authority or private script? Shawan, can we tell that on?
We can actually see both authority, PBS prescribed, private script. So this is one of the advantages over the PBS doctor shopping information, which is only PBS.
That's great.
And we can see it in real time.
Great. And Jay Turton is asking, do the pharmacists see this information as well?
Yeah, they can see it as well. Yeah. And I think there is some information from New South Wales. I think that New South Wales pharmacies, or at least the Queanbeyan ones, seem to download their dispensing information. So I've certainly seen that, but not for people who are New South Wales. I think they might have to be from the ACT. I must admit, I'm not 100% sure, but I've certainly seen scripts that are dispensed at New South Wales, or at least Queanbeyan pharmacies.
I might ask Shawan, one of our team, if he can answer that question for us more fully.
So with the prescriptions that we can see, usually if it is an ACT patient, we can actually see all the dispensing even across Australia. And also we did have initially when we did Queanbeyan put in as an ACT area as well. So you might see some of the Queanbeyan patients dispensing. That is a legacy thing. But if they actually are New South Wales addressed, it is very likely that we wouldn't have the full information for those patients. We will only have the information, guaranteed information from ACT.
Lovely. Thank you, Shawan. I think that's all the questions that are there at the moment, but keep putting them in the chat box if you like, and we'll answer them as we go forward. So thank you, Marianne, for sharing those case studies and giving us the benefit of your experiences with Canberra Script. I feel the cases and scenarios you've described will resonate with our audience for some time to come. I think they've highlighted some of the uncomfortable and challenging scenarios most prescribers will face at some stage in their practice. And yes, the pharmacists can see the same imagery as the practitioners can see. So we're all connected in this one system. And our next speaker is here to help you efficiently navigate your way through Canberra Script and draw out the information you need to make an informed decision in relation to the patient in front of you. Please welcome Michael Fitzsimons, Deputy Chief Pharmacist and Director of Pharmaceutical Services Operations. Michael has over 30 years of experience as a pharmacist, having previously worked in the community and military settings before making the move to regulatory pharmacy. Michael has led the Pharmaceutical Services Operations team for the last decade and has overseen the development and release of both of Canberra's real-time prescription monitoring systems. Over to you, Michael.
Thank you, Amanda. We've heard from Dr. Bookallil about using Canberra Script in practice. Now I want to show you some tips and tricks about navigating the system. I'll just share my screen. So what I've got up here is the Canberra Script landing page and website. This has all the login details. It provides help and support for and information on Canberra Script. Just before I go on those practitioners who have not registered for Canberra Script yet, you can register from the Canberra Script website by just clicking on the register page in the middle, and it will take you into the registration process. Before you register, you'll need to have your prescriber number, your APRA number, and access to your email that you have registered with APRA. The registration is a 4-step process and should only take roughly 10 minutes to complete. Oops, I'll just go back to there. We also recommend that you actually save this in your favorites on your web browser. Obviously, I'm using Google Chrome at the moment, but add it to your favorites. And you do need to log in to Canberra Script off this page. If you try to save the login page, it does cause some errors and some problems with logging in. So we always suggest that you log in from this page. Up in the right-hand corner here, we have our help topics and also our contact us hyperlinks, and that's full of quite good information about little bits and pieces on how to set up your system, and also some help guides in relation to the use of Canberra Script. When you are setting up your browser and for Canberra Script, it's best to actually have the most up-to-date browser, and also to enable your third-party cookies to have to use Canberra Script and have it run optimally. You can find further information on this around in the health topic area. The Canberra Script also has a mobile app as well, available for Android and iPhone. The functionality on the mobile app tends to be limited to the prescribing and dispensing events. So at least you can access that information if you happen to be not in your office or doing consultations from a remote location. So to log in, you just click on the login button on the website, and it will take you through a series of screens. You'll need to enter your username, which is usually your email address that you have registered with APRA, and also your password. Obviously, the good thing about this particular system is that it does have a forget your password function that actually works. So if you do forget your password, you can click on that button, and you will need access to your APRA registered email as well, because it will send you the reset details at that email address. There is also a multi-factor authentication component as well. So after you enter your username and password, you'll be asked to enter a multi-factor authentication, whether that be on an app, through a text, or by a telephone call. I'll mention a little bit about setting up multi-factor authentication later in my presentation. So once you go through that process, you'll end up with I don't know whether my, no, it hasn't. You'll end up with, after the first time you log in, you can set a 6-digit quick access PIN number, and this allows you to access your Canberra Script for up to 12 hours. For security reasons, Canberra Script will actually log out or revert to the 6-digit PIN page. It'll just ask you to enter that in, and you'll just enter that 6-digit PIN without having to go through the full login and multi-factor authentication process. So I've already logged into our user acceptance portal, and the portal is actually quite simple. It has 3 main areas of obviously patient search, which I'm in now. It provides you with a list of your approvals, and also has correspondence as well. Before I go into detail with each of these functions, I'll just quickly run through some of the functions in your user profile. The main ones of interest are obviously you can change your password here if you believe it's been compromised. You can set up and manage your multi-factor authentication. And there's 3 different ways of authenticating the system. We recommend you at least set up 2. And we highly recommend that you set up at least the Authenticator app and the text message, because if you happen to lose your phone and you forget and you have to have your phone number change, it means you actually have to go to Fred IT support to actually have your multi-factor authentication re-established. Whereas if you've got two ways of doing it, at least you can, especially with the app, at least you can get in there and you can actually modify your phone number from there. If there's anyone working from ACT or for ACT Health, either up at Canberra Hospital or at Calvary, you can link your ACTGov account to that. So all it means is you just click on the link when you're logged into your ACTGov computer up at the hospital, and it will actually link up. It's just a simple process, and I've now linked my account to the dashboard. So if I go back in, I can see that I have now linked that account. So when I'm on an ACTGov computer, all I need to do is just in the username type in my email address, and I'm off, so long I'm logged in under my own credentials. So let's have a look a little bit more around the main functionalities of Canberra Script. So I'll do we're in the patient search segment of the system. So the good thing about Canberra Script is and it's probably actually a little bit of an advantage, is you don't actually have to type in the full person's name. You can put just up to one letter in at least you have to at least have one letter in the first name and about 2 or 3 in the second name. And what it will do is bring up patients with that combination in it. While we're here, I'll quickly just run through the record types that we've got in the system. So there's 3 different record types. The first one is the little prescription sign. So this is a record that only has the prescribing and dispensing information in it. There hasn't been any regulatory file attached to that. Down the bottom here, we have where we've got the little card here. This is a patient profile that just was created by Pharmaceutical Services to create a CHO approval, but the patient actually hasn't had any CHO approvals done for that one. And then of course there's the little link chain here, and these are actually records that have both a dispensing and prescribing information in it, as well as a regulatory profile, which is likely to have CHO approvals in it as well. While all the records here have dates of birth, there is a default birth date of 1st to the 1st 1800. This is where a record has come across without a date of birth, either from the prescribing software or the dispensing software. So if you find a record like this, we would encourage prescribers to make sure that the date of birth is on the prescription, maybe just highlight it, and that will prompt the pharmacist to update that information. Also, it is a cause of duplicated profiles as well. So if you do find any duplicated profiles in the system, please let us know, and we can raise a ticket and have that fixed. So I'll go in and have a bit of a look at what a patient profile looks like. So again, we can just type in the first few letters of the patient's first name and last name. And usually for a link profile or a prescription profile, it will always bring you to the dispensing and prescribing screen. You'll notice here that the event types are labelled here. So green's for a dispensed item, and prescribed is for obviously a prescription that's been raised from a practice that has a linkage into one of the prescription exchange service, ERX or MediSecure, or it's probably done or has is eScript ready as well. They are all visible in Canberra Script. There are a couple of other types there as well. Obviously, there's two cancelled ones for dispensed items and for prescribed items, which usually show up in red. Over on the left here, we can see that you can see the little alert symbols, and if you click on the you can actually click on each event and it will bring up what that alert is. This one's a concurrent supply alert because the person's been taking opioids and benzodiazepine. So this is one of the concurrent supply. It just means that it is a combination which does increase the risk of harm for the patient. Up the top here, we do have filters. So as you could see before, during Marianne's presentation, you're able to filter on particular drugs if you wanted to. You can filter on whether you just want to look at the prescribed events or whether you want to look at dispensed events. So it just provides a more succinct list of medications. You can obviously adjust the date range as well. There's some pre-filled ones here. Otherwise, you can just click on the calendar as well and filter on those. And you can also group them by generic medication or trade name medication as well. And what that brings up is a small cascade of drugs. And then you can open up that accordion and just see those particular drugs there. But it can also just provide you with a quick summary of what's actually been prescribed as well. And there's also filtering within the top here as well. So you can just obviously just filter on the doctors from here, and you can also rearrange the order as well by clicking on the icons as well. So you can, if you need to view any of your CHO approvals from the patient, you click on the patient profile, and this takes you into the regulatory side of the system. Obviously, you can click on CHO approvals, and this will actually list all CHO approvals for the patient. So it'll actually tell you whether it's yours or whether it's another prescriber, and you can also click on correspondence here as well. To view a CHO approval, you just double click on the particular approval, and you can then you can view the approval on your screen there. There's also there's an accordion up here as well, which you can actually, if it'll shortcut you back through the patient details as well. Up in the right-hand corner, another good feature is the access history, and this provides a list of all the practitioners who have actually accessed this particular patient's record. It's actually not a bad function, because you can actually, especially if you've got a patient who has a lot of alerts and is doctor shopping as well, it gives you a little bit of idea on how many prescribers and pharmacists they've actually visited, because there may be some prescribers or pharmacists who haven't actually prescribed or dispensed. So it's another way of gauging, the activity of the patient as well. Oops. The next function is the CHO approval search. This in the approval section, you can view all your approvals linked to your clinic. So if you are moving clinics, or please make sure you contact Pharmaceutical Services so that we can update your details on that, so that you can view all the approvals in that clinic. If you are working at more than one clinic, you will be able to view across those clinics. Please also note, just in this particular one, we're actually running a beta version of the user acceptance testing screen. It does have a feature that will come up, is this grouped by feature. The current version doesn't have it, but it actually allows you to either filter by just your approvals only, or by the practice. So you can actually just have a look at your approvals as well. Again, you can filter on any one of these columns by pressing on the oops, my thing stopped. And you can select just looking at the approved ones. If you're unsure about whether or not an application's been approved, you can, or you think it mightn't have been approved, you can have a look at what's cancelled, pending, and also, we do if something's waiting on. Occasionally we'll ask for specialist support or further information, and you can filter on that as well. The other, so you can actually go into that particular CHO approval, and you can view the correspondence to that as well. So it will provide you with what we're actually, if you haven't received a copy of it, you can go in here and find out what details we're looking for as well. Certainly, if you're interested in using the Canberra Script CHO approval function, you can contact us here at HPS. The final part of it is also, just quickly on the approval side of things as well. The default setting on the date range is only 3 months. So if you do need to look back further, you will need to manually filter for, say, the last 12 months or 2 years. They've done the default at 3 months just to make the system run a little bit faster, but all you just need to remember that it is only 3 months. The last feature I'll just show you as well on this is the correspondence page. Now this includes all the decision letters from your CHO approvals, and it also does provide some approval expiry reminders as well. So for instance, there's a message here to say that the approval's expired, so it provides the details of that approval and the patient's name, and obviously when it expires. So that's quite a handy feature to have. It also, as well, on some of the records, you can see that there's actually the patient and the approval that it's linked to. So if you want to actually go straight into the patient file from here, you can just click on the icon here, and it will take you straight into the patient's page and look up whatever you need to the CHO approval from there. Also from the correspondence page as well, you can send us a message by just clicking send a message, and then you just fill in the details there if it's about a CHO approval, or it might be about a CHO approval. You can attach it to the patient as well, the patient details. There's an area for just adding the description in there, and if you want to attach any correspondence, you can do that as well. One of the features that will be coming out in the new version is this red box here, which will tell you how many pieces of correspondence haven't been read yet. So the current version doesn't have that. So that will be coming out in the next version as well. I'll go back to the slide pack now, and we'll just run through the alerts and notifications. Michael, can you bring up the... So for the patient profile and notifications, obviously we had a look at the alerts in the patient profile. The alerts detect where there is basically a high. Well, some of the alerts will tell you whether there's high-risk combinations. For example, people taking OMT or opioids along with benzodiazepines. There's a number of alerts for doctor and/or pharmacist shopping. And this looks at the history over the past 60 days, and there's varying degrees. It's basically 3 or more prescribers or 4 or more pharmacists for that one. There is a feature called Patient Safety Notice, which we use on occasions within PSS. It's basically the old named alert that we put out to doctors and pharmacists, where we've identified a patient who may be in imminent risk of harm. And the last 2 alerts assist prescribers in letting them know whether they've either exceeded or do not have a CHO approval for the prescribing of controlled medicines. Some of the practice management software, such as Best Practice and Medical Director, have integrated notification software with Canberra Script to notify prescribers where there is an issue or not. The pop-up notifications are color-coded based on risk and will be activated when you are prescribing incompatible software. These notifications are based on the last 90 days of data, and the traffic light system is again based on risk. As a general rule, obviously green is there isn't any alerts of interest for the prescribing. If you do get an amber alert, it's recommended that you look at the patient record during or after the consultation. But certainly if the notification is red, it is highly recommended that you look at the patient record before issuing the prescription. We'll just move to the last slide. This slide highlights some of the resources and support links for users. And further information can also, and the help topics can be found on the Canberra Script website. All this information on the slide will be sent to you via email after the webinar. I'll now hand back to Amanda for closing comments and questions. Thank you.
Thanks, Michael. It's wonderful. I always enjoy learning a little bit more about the system every time I look at it too. So thank you for that. We did have a couple of questions that I just wanted to cover off. One of them I've answered on the chat already, but we'll just cover it anyway. So LM says, what if my practice software is not compatible to integrate with Canberra Script? And of course, the answer for that would be to use the web page and log in via the login button on the canberrascript.act.gov.au page. And Saiful says it's been making their computer slow or dysfunctional for a few seconds when prescribing S8s and S4s. And we have had a patch applied last night, so you should already notice some improvements to that. But if you ever have any ongoing issues, please contact the team and we'll ensure that our software provider has a chance to look at those. And then Emil has said often when we're applying for CHO approval, a supporting letter from a specialist is required. How do we do this using Canberra Script, or will we have to separately send an email or fax for this? Michael, would you like to answer that question, please?
Yeah, you can actually attach documents to the CHO approval as so when you go through the accordion process, there'll be correspondence down the bottom of the CHO approval form. So you can attach the specialist support to that and send it and that we will receive that when you submit your application.
Thank you, Michael. And then Alexandra has said, can you go through a quick way to repeat a request for CHO approval, Michael?
I might get Shawan to answer that one, but there is a short way of doing that.
Shawan, you're on mute. Welcome to 2022 when we all have to unmute.
Look, I'll just quickly share my screen. The reason why we haven't touched based on applying for CHO approval within the system is the current form, which is in Canberra Script, is a beta version, and it may not be very intuitive for use. So what we were hoping to do was do one-on-one training for GP clinics if they are interested, so that they get more out of it rather than in a quick seminar like this. But with approval, I will just quickly show you an approval now, how to create it. I'll just share my screen now. Hopefully you can see it. Is that okay, Amanda or Michael? Can you see it?
Yes, we can see that.
Okay. So with the application, what we have done is we have grouped it as different approval groups. So you can select whatever the group it is. So if it is category 1, you just take acute or chronic pain, you select that one. And then one thing that the way the system is set up is that it got something called an action menu. So you have to select the action submit, which people tend to forget as well, because otherwise if you save it, it just saves in the system. So that's why these are some improvements that we are looking at to implement in Canberra Script online forms later. So we will be moving that to the bottom of the thing, and also there will be like a mandatory fields better highlighted as well. But for this purpose, what you need to do is you need to select it as submit. You then select the patient with Carla. And then you select the drug dependency option, yes or no. That's a standard question we need to answer. Your details will be automatically selected. And if you work in multiple clinics, then you will need to select which clinic you want to assign it to. Otherwise, if it's only one clinic, that will be automatically selected. And then you can provide whether it's a category 1 or approval by drug. So if it's category 1, you select category 1. Then you do, what type of, so if it was for chronic pain, you select what type of pain it was. and then if there was any correspondence you wanted to upload to that approval, you can just upload and then you just save it. So once you have done that, the approval status will change to application submitted. That just shows that the application is actually submitted for us. Definitely that is the simplest, creating a new approval. There is a renewal option in the system as well. However, I think I know for the time, I will just leave it there. But if your clinic is really interested in, starting to use the online form at the current form, which is the beta version, let us know. We can offer a one-on-one training for you. Yeah, I'll just stop there.
Nice job, Sharwin. I think you answered Emil's question, Alexandra's question, and the anonymous attendee asking if we can go to clinicians in one go. Thank you very much. Jay Turton has also asked a question around shared responsibility that dispensing pharmacists bear in patients who are using drugs of dependence. And I think it's probably fair to say we all share responsibility for minimising harms for our patients. The more we can all do to work collaboratively together, the better the outcomes for our community. That's my answer as a often clinical pharmacist. I'm not sure if anybody else has any other opinions they'd like to add, but I'll probably leave it at that. Shyama has asked, for Queanbeyan residents, can we apply for CHO approval, or do we need to apply through New South Wales relevant authority? And that will depend on whether they're having the script dispensed in the ACT or New South Wales. That's correct, isn't it, Michael?
Yes, it is. So if they're intending to get the prescription dispensed in an ACT pharmacy, a CHO approval will be required. Obviously, if they're getting it in New South Wales, they don't need to get that CHO approval.
Thanks, Michael. And Mel has said it would be really helpful, and I actually quite like this question, Mel. I'm going to pass it to Sharwin, our subject matter expert, to have a feature where there's a calculation of the number of tablets prescribed or dispensed over a period of time, e.g. how many Targen tabs over 6 months. Mel's got a new patient on Targen, Palexia, diazepam and endone, and spending time trying to work out how much she's been prescribed is a bit tricky. It sure is. Sharwin, is that something that's coming in the future?
Look, not on my understanding. So I
Immediate
don't
agenda?
think. Yeah, look, I mean that's a really good actually feature. And we will actually
Yeah.
put that on the backlog on, features that we would like. One of the struggle that we do have is that it's a national system, and some of the core things like the way the medicine is displayed and everything is actually common across every jurisdiction. So changes to that will need to made nationally so that it's available for everyone. So definitely that's a good feature that we could actually propose on behalf of ACT for the national board as well. Yeah.
It's a great question, Mel. Thank you for that. And I will task the team to pass that back to the software vendor. And Brenda has asked, can the upload document function when applying for approval online mine the software for specialist letters? I suspect not if using a web browser to access Canberra Script. Sharwin, that's a technical question for you again.
Yeah, that is correct. Unfortunately, yeah, it doesn't have a feature where you can actually drag and drop directly from the software. I think that is more if more a security thing within the prescribing software, because the system is not within the prescribing software itself. You wouldn't be able to do that. Yes, if you had to send it to Canberra Script, you would probably have to save it on your desktop and then drag and drop. But uploading is simple, so you can just click on the upload and then drag and drop. So you don't need to search and drop. But unfortunately, you will need to save it on your desktop because of how it doesn't interact with your prescribing software.
Thanks, Sharwin. That's great. I think that's all the questions in the chat box tonight. So at this point, I think I'll let us all move on with our evenings. I'm sure you've all had a busy day at work, but I'd like to thank all of our prescribers for attending. And I'd like to thank our presenters, Dr. Bookallil, Michael Fitzsimons, and Sharwin Verghese. I just wanted to remind you all the importance of improving medicine safety, as I mentioned, is a responsibility we all carry. From a regulatory point of view, having an interested and engaged community of prescribers is key to progressing any harm minimisation initiatives. And I'd like to remind you all as we close of our key message that Canberra Script is intended to support clinical decision making and facilitate the safe and effective use of monitored medicines by enabling prescribers and pharmacists to better identify and manage patients who may be at risk of harm or dependency. So if you haven't already done so, please register for Canberra Script today. And as we discussed earlier, do always feel free to contact the team if you would like one of our engagement team to come out and visit your practice, or if you want to send an email to ask a question, please do so. We're always happy to be here to help support you all. Thank you, and I'll pass back to Jeanette.
Thank you for that, Amanda. Just wanted to add, we had Brenda just ask her one last question. Are we going to be able to continue to use HealthLink from within our software? Just to answer that before we finish.
At this stage, the HealthLink smart form will be online, but we haven't got a date for decommissioning yet, but it will be decommissioned, and we will be moving over to the Canberra Script online portal as the electronic means for applying for CHO approval.
Thank you for that. I guess thank you once again to all of our speakers and all of you who have joined us in tonight's webinar. Kindly answer the post-event survey that will show up on your screen shortly. An email containing the webinar's recording and other useful resources will also be sent out to all registrants as well. Thank you and good night.